Now today we're talking about cultural safety in an outreach program. It's a really important topic. At Werin Medical Clinic, we started with the outreach program around 4 to 5 years ago with one little clinic, and it's now grown to around 14 clinics just purely through the Rural Doctors Network. So it's a massive service for us. The service gives our patients a lot of health benefits, and without it, the access to those services in the Port Macquarie area would be really severely restricted. So having that culturally safe place where our patients can come and access those services has really made a difference to the health outcomes in the community. So I might throw over to Jackie. So Jackie is from Awabakal, which is in the Newcastle area, isn't it? Yeah. And you're an Aboriginal health worker in the outreach team.
Hi everyone, my name's Jackie. I work with the Awabakal Medical Service at Newcastle. So we cover, we go to Kurrawa, Port Stephens area. We go to Maitland, which is Mindaribba down there, and we go to Toronto, which is out Lake Macquarie Way out of Newcastle. So we cover 3 outreach clinics. I take a different GP with me every day. I love going outreach. I love going out on community. I usually take my guitar and, that's a way to engage our clients, sing a song, play music. We all know our people love music, so it's just a way to break the ice, I suppose, with our people. We've got a video presentation later on throughout the day, which Amber's going to put on for us at some time. So you'll get to have a look at just what we do, I suppose, in our outreach clinics out on country. Oh God, it's nerve-wracking, this, isn't it? But what do you want me to say? Like, we have a van, so we have a mobile clinic that we take out on Mondays to Kurrawa. I have a chronic care nurse with the New South Wales Health team. She comes out with us, so she piggybacks with us on once a month on our clinics to see our diabetic patients. As an outreach worker, I use my phone a lot because there's a lot of referrals happening. The GP sits in and I suppose as a nurse, I qualified as a nurse yesterday, which is a bonus. I just throw it out there. But so I feel as though I was limited, I suppose, as an Aboriginal health worker, but now as a nurse, it sort of opens. I can legally do things like removal of sutures and a bit of wound care, but it's a different scope of practice, I suppose, and it's very positive for our mob to have that Aboriginal face to do things. They're more confident to come and open up and tell you what's going on. I suppose I interpret the terminology that they don't understand with whatever's going on with their conditions, so that's a plus for me. With our clinics also, the van we take out on Mondays to Kurrawa, there's only the doctor and myself, but then we have the chronic care nurse that comes out also, and the Lands Council provide the hall for us, so we have the play group there on Mondays too, and so it's easy. We see a lot of the kids, we get smashed on our clinics, up to 30 patients a day, so we're lucky to have a lunch break. We get 20 minutes or something, 18 minutes, and because we know once we get back from lunch, our clients will be there waiting. Time is important for our people too. They don't like to be kept waiting. Tuesdays at Toronto is a different clinic again. The Ninkenpa Aboriginal Families and Children's Service out there provide us 2 rooms. There's 3 rooms actually, because Donna, our chronic care nurse, comes out and she has a room there too. I'll just get Donna to put her hand up so you can shout out to Donna. Yeah, so any diabetic clients and that, we refer to Donna, and Donna will do their HBs and do their diabetic cycle of care. And, I'm the OBS person. I do their OBS and have the yarn, and then I send them into the GP. So, which is really good in one way, because the GPs, they always comment on how good it is for me to see them first, because they'll open up to me more than they will to their GP, which is a good thing for our mob. Wednesdays at Mindaribba is a different community again, servicing the Maitland area, and so the Lands Council there provide us rooms down the back for our clinics, and it's good there too because they have a gym, so if you stress, you can go in and use the treadmill. which we don't anyway. Yeah, but like, so the cultural safety of it is that, like, we never leave each other either. Like, there's always got to be the AHW and the doctor. So well, sometimes I have to, because with transport, I need to go and get these clients that aren't coming to their appointments, which is, it's not risky because there's always someone there with Arti anyway, or my I'll shout out to Arti over there. That's my GP I take with me to Minda on Wednesdays. So I have two males and the female doctor, and it's good. I love it, and the cultural safety is we look after each other. It's about communication and making sure we're all on the same page with whatever we're doing, with anything we're doing for our people. Thank you.
Thank you, Jackie. No, that was great. It is. It's just one of those things in an AMS. It's a very organic process. I know for us at Werin, I think our staffing is up over around 75% Aboriginal staff members, and that's around 20 people. So that in itself, having those Aboriginal people in all those key positions, making those key decisions, makes it a very organic, culturally safe process. Trish Levett. So Trish is from Illawarra AMS, and she works in the cancer care team.
Hi, Werin, good morning in Gundungurra language. I'm an elder on country up in the Southern Highlands. I've worked in the cancer care team for 2 years now. So it is an Aboriginal service for all of our mob. It's very needed. You're talking about cultural safety. We need to break down these barriers, like in the hospital systems. Recently we worked with Wollongong Hospital, and outside of oncology now we actually have some Aboriginal artwork along the wall. So that's all part of cultural safety as well. It's a needed program within not just our area, but other areas as well. So what we actually do is work with mob precancerous. We actually go with them for, biopsies and tests. And after that, if they need further treatment, we'll go with them for chemo. So that's all around that cultural safety as well, making our clients, feel comfortable while they're in the doctors. That's it. We have a lot of resources. We found with, especially in cancer, there was no cultural resources that were available only in Victoria. So we've actually developed and designed all of our cancer resources, which we've got here today, which we'll present at the tabletop. So being a pilot program as well, it's been a bit tricky, but we've developed it from scratch, and we love it. We're very, very blessed. And we've just set up a cultural staff safety training program with the AMS. So all new staff members that actually come and work through the AMS now actually have to go through the cultural safety training program, which is not cultural awareness. There's a big difference between cultural awareness and safety training. So, to keep it culturally safe.
Excellent. Thank you, Trish. So next we've got Kristika Kumar from Waminda.
Hey everyone, my name's Kristika Kumar. I'm an Aboriginal and Fijian Indian woman. My mum's from Wreck Bay, South Coast, New South Wales. I've been with Waminda for about 5.5 years now. Started from reception and went into program support, and now I'm an Aboriginal health practitioner studying nursing, and I love it. We provide a lot of in-house services, so we're the Aboriginal health workers and the cultural link between our GPs and other specialists and allied health services. In-house, we have 5 GPs now, 3 Aboriginal health workers, 2 health practitioners, 2 midwives, a nurse practitioner that we just employed as well, and we also have a case management team upstairs. And what about our allied health? We have a physio that we refer to, a podiatrist, and ear health as well. So it's really good for our community. It is, but Auntie Jackie pretty much covered everything what we do on outreach. So we actually cover 6 different communities. One being Jerinja, Wreck Bay, Gerringong, Ulladulla, and Narrabomidary. So me being from the Wreck Bay community, I go out there every Friday, or Thursday, sorry, I'm a bit nervous. So I go out there every Thursday, and it's a bit hard because it's a bit of a black spot. There's no reception, or we can't get onto the computers out there. So we go into the clinic and we provide health screening, and we can also go out and do home visits as well if our mob don't feel comfortable coming up to the clinic. I'll just give one example. I was in the clinic for my very first time, and one of the ladies actually came in looking for a Band-Aid, and she goes, "Hey sister, what are you doing here?" And I sort of explained what I was doing, just some health screening, some education and resources and what we were there for. And she goes, "Oh, what's that?" I sort of explained to her, and she came in and she ended up having a little health check done. I done her blood sugar levels and it was sky high, and it gave a lot of positive reinforcement back about, it was good that she was getting this test done. And she was wondering why it was so high, and we talked about, diet, health and lifestyle, exercise, what it means to have a high sugar level and stuff like that. So it was a really opportunistic time to make appropriate referrals, give that education to her, resources, be that supportive person, to support her journey. So during that, made a call to our GP, because we unfortunately don't have a GP that comes out to clinic with us. So, made a referral, got her in, transported her in there, started off her, she was diagnosed with diabetes. So started off her journey around management. So done a diabetes cycle of care, HbA1cs, talked about diets, and linked her in with a diabetes educator and dietitian, podiatrist and optometrist, not bombarding her obviously, but being that person to support her through a whole journey. And every time we go back out to outreach now, she comes up really excited with lower sugar levels and talking about new diets and weight loss and stuff like that. So yeah, it's a really positive experience, and it it melts my heart seeing our mob, changing and growing and having positive outcomes. That's my little story.
Thank you, Kristika. Okay, next up is Loretta Longbottom, and she's also from Waminda. Yeah.
Hi, I've been employed at Waminda for 9 months. My background was totally different from being in Aboriginal health. I come from an aged care workforce, so going into Aboriginal health was my passion and stuff. So I'm employed as an outreach worker. I go back to my community, which is Rosie Park, aka Jerinja. It's good to go back out in community and to be known out there as a health worker. I like to go out to the women and just say, just here to monitor your health issues. Is there any barriers, or have you been regular with your health assessments, with your health like 715s, and make sure that the HbA1cs are all up to date. And if they don't understand, some of the women have these blood tests and they don't understand what they're getting them done for. So, and then you're educating them why the blood tests are being done, why the doctor has sent them to this specialist, to that specialist. So it's educating them if they don't understand, and it's giving them resources. A couple of women out on the community didn't have no BGL monitors, so I've accessed those for the women so they can keep their sugar levels, monitor their sugar levels, and they can let me know whether they're going up or down, so I can educate them which way to go and stuff like that. So, and finding that they feel a bit more comfortable as you keep going out and building that rapport, building that relationship with your community members, so they can feel comfortable and coming in and asking you questions, and you're there for their guidance and support and follow their journey. And so that's my part of outreach. That's the good part, yeah. That's the best part, is following them and making sure that they're going okay.
Excellent, thank you very much.
In our cancer care team, we actually run a traditional healing program as part of our healing spiritually, especially for our women who have been through treatment or, have actually lost a loved one with cancer. So, we actually take them home to my country, which is only an hour's drive from our workforce in Wollongong up the mountain. So, part of their spiritual healing is also connecting back to country. And I also think that, in a lot of programs, that's what we need to do is start, getting our mob, back into culture and, all those things that you've just sort of suggested.
My name's Rebecca. I only recently came across the terminology cultural safety. And when I returned to work and, discussed it with my work colleagues, there was not a great understanding of what it meant. I'm just wondering if you can help me understand the difference between cultural awareness training and cultural safety training.
We have a cultural safety committee, and it consists of staff members and board members, and community members, which is part of the board. Yep. And it's a cultural induction of the area, not only specific just for people that come from the community, it's for non-Indigenous people as well that's within our workplace. There's two lots of different inductions. There's the slideshow and talk about their experiences if they've come across Aboriginal people in communities and stuff. It's just talking about how you grow up, how your language, what's important to you for your culture, your spiritualisation on land, going back to land, healing and stuff. And then there's the second step for the cultural committee through Wominda. They go out on country as well, take them where there's significance, stories and stuff like that is for anyone that works within Wominda. We do have healing programs at Wominda, and they do go back on country and do camps, and so the women feel comfortable talking about what they've been through and stuff like that. So
Healing from inside.
And healing from inside, and because I don't know, can I say this? We believe that, medications aren't always the fixture of people's illnesses, They need to go back and reconnect to their own country, where they come from, be with family, talk over their issues. Don't just medicate them and say that they'll be fine. Don't just band-aid the situation, because there's more deeper issues there that need to be resolved and spoken about.
Thank you. Another question?
I'll jump in. Sorry, Pat Oakley. I'm a doctor working at both John Hunter half my time, and the other half I get to hang out with Jackie and the folks at Biripi and go out the valley. So it's half Aboriginal health and half John Hunter based. So it's wonderful to talk to all you guys. Love your work.
Just to address the question on cultural safety, for us in nursing, one of the most relevant things that ever happened was a Maori woman called Erin Hippity Ramsden, who developed the cultural safety, the way of educating people, and it was all based on power relationships. And I think everything everybody's talking about is a power relationship. And often when we go out as Aboriginal workers, we're not seen in a power relationship, and we have to keep ourselves as equal partners, and that there's no hierarchical, there's no doctor, nurse, health worker, cleaner, that we're all like a big pizza, we're a slice into, we're all on the same level. And she was brilliant in articulating what cultural safety is, and it all, absolutely, everything comes back to power relationships. And if we don't hold power over our patients and they are equal partners, then we will always recognise their spiritual needs, their cultural needs, their modern medicine needs, and their desire to have the whole lot mixed in because they want to live a well and happy life. But it's about power, and the safety part is that You can have cultural education and cultural awareness, but it's not until you implicate it that you are a safe practitioner. But it's all about power. Everything comes back to power and dissolving any power relationship, social, economic, clinical or anything. And if you could read anything on her work, she articulates it beautiful and changed everything in New Zealand, everything around nursing to address cultural safety. So she's a good one to read if you want to understand what it means to be culturally safe. Erin Ramsden.
My name's Aidan. I work with Checkup, we're the jurisdictional fund holders for Outreach up in Queensland. I started my career off as a podiatrist, a new grad, delivering outreach health services up into the Gulf Carpentaria. And I guess during that time, I learnt a lot, but particularly that the local Aboriginal health workers were a great source of knowledge. They know the communities, and also they see all of the visiting health professionals come and go. So I have a three-part question. Excuse me, based on your experience, what do you find that visiting health professionals do well? What do you find that visiting health professionals don't do so well? And how could they improve?
The first part of the question was, what do they do so well? I think they're engaging with the community, their time frame, they don't make them wait around. They're straight in. We have access to MD, so I do a lot of their notes before they go into the doctor. So by the time they get in to see the doctor, he just reads up on what they're here for, and it's like, wham, bam, thank you, ma'am. Yeah. What they could improve on is, our biggest issue out on country is IT. Service networks, our laptops are pretty old. We're lucky to have a phone at the moment, so we're using our own mobile phones. I think that whether it's the organisation or whether it's whoever funds our positions, they could help us out with some new technology.
All right, well, that about wraps it up then. I'd just like to thank you all for coming out, being as nervous as I am.
My name's Jackie Khan. I work for the Awabakal Medical Service in at Newcastle, and we provide an outreach service to outlying communities in Newcastle area, and I am the Aboriginal health worker for outreach. So we have 3 outreach services. This one's at Peru on Monday, Toronto on Tuesday, which is at Ninkenpa, the Aboriginal Child and Family Services Centre out there, and then Wednesdays we have an outreach service out at Minda River, which is in Maitland.
My name's Dean Wright. I work for Awabakal and I'm one of their GPs. It's a lot easier to look after people in their own patch, and they're happy that I'm there, It's really, and it feels like you've got a bond because you're within their mob. So it's a lot easier to look after people on outreach. Technically it's more difficult, but you get better. People communicate more, they feel more relaxed, there's less pressure on them, with the travelling, and they can just walk past and see if we're there, and they'll come in, and we do walk-ins and stuff, so, and it's very much, they feel that we're providing a service rather than sort of, we're out there trying to positively help them rather than just sit back and see what happens.
Yep, so my name's Arti Malhotra. I work for Awabakal Medical Centre and I'm a GP registrar, final term. Yep, so I go to the Maitland or Minda River outreach. So that's, basically we see all the patients around that area. It's every Wednesday, go out with the Aboriginal health worker or the nurse. And it's always a good day.
Hi, Dr. James Stephen, or Jim, people call me Jim. I'm one of the GPs at Awabakal Medical Service. And I do the outreach clinic out to Peru. This is pretty busy actually, and we come out here in the truck to the mission and see a whole range of general practice business, sort of little kids, old people, everything in between. It's like a normal general practice day, to be honest, in Aboriginal community controlled health, but set out here in the truck out in Karua. Me and Jackie come out here. She's the Aboriginal health worker that I work with, and she's an invaluable part of the team. I couldn't do what I do out here without her. She's the link in with the community, and keeps us amused as well.
So we have our outreach clinics because a lot of our community can't make it to town to the doctors, so we provide a service to come out to the community so they can come and access the doctor, see the doctor if there's any for anything they want, I suppose, for any of their health concerns. We do immunisations for the babies, we look after the elders with their chronic diseases, and we look after all age ranges, I suppose.
You want a patient to be able to come in, without having to think twice about coming in and, talking about their health problems or their mental health problems, and, know that they're not going to be judged, they're going to be looked after. So I feel that's what we mean by, culturally safe, and obviously having that background and that understanding about all the challenges and barriers that they where they're coming from and what they're, going through to get to this point. And I think the way we do that is, feel like the most important thing is, from the moment they enter the door till they leave, every staff member is trained and has a good understanding of patients' backgrounds and the communication skills that we use, so being non-judgmental, listening to them, giving them the choice to make the decisions, and empower them in their own healthcare. I think that's really, really important. I guess the other thing is understanding challenges such as transport and, financial problems that a lot of our patients have to deal with, to look after their health. And the health is often not a priority, but by helping them with all these other barriers, we can really, improve their ability to access healthcare. So we've got our own, transport drivers. And that's the reason we also do these outreach clinics, so we can go to the patients and they don't always have to come to us. And in terms of financial supports, there's a whole bunch of staff at Awabakal that, and we can get them on board. So we've got people to help with housing, we've got people to help with, referrals to other health services. We've got like our mums and bubs groups. We've got a whole range of, wholesome healthcare that we can provide to the patient. So that just makes them feel more a part of this community, and it is definitely a very community feel.
My name's Kylie Beatson and I'm part of the Karua community. Yeah, because there's a lot of families out here that haven't got no transport to get into Hamilton, or a lot of them have a lot of mental health issues which they can't travel by public transport. So it's good to have them come out.
Well, I think it's the access. It's people being able to have access to health services, and having the truck here and having Jackie here, having a friendly service that's not mainstream, but run by Aboriginal community control, that makes it something that people feel comfortable to come and engage with. And that's probably you won't get anywhere unless people feel comfortable and come through the door.
So one of them is that we're sharing that clinic with other doctors and other health professionals on other days of the week. So we can't always set up the room exactly how we want it or have, all our equipment there. So, we do bring along all our own equipment and medications and have to rearrange the room, small things like that. Another thing is the technical issues with the computer and the network and things like that. But IT guys are onto that, and apparently it's all going to be sorted very soon, but that's all right. And I guess, probably one of the biggest things is the fact that we do only go out there once a week. It does get booked out quite far in advance, and not all the patients that want to be seen there can be seen there. And also if it's something more urgent, they can't necessarily just plan to get sick on a Wednesday, so that can be a little bit of a challenge as well. Having said that, we do have drivers down in Hamilton and Newcastle that can drive patients over here if necessary, but it'd be great if we had unlimited resources and could go there every day of the week, but we work with what we have and we make it work. So some room for improvement, but you know, we're getting there.
Very important service for our people because there's so much going on that they can't get to appointments in town, and for us to be able to come out on country and mingle with the community, I suppose it's even better for us as an organisation too.
Oh my word, yeah, it's definitely needed. People, and it builds trust in that community with Awabakal, with the community controlled health service, because you know it's declaring to them that the board and the health service want them to be part of their body of work treatment.
It's definitely a lot of fun because there's only so many people in that community. You get to know everyone really well, and you start to feel like part of the family. So that's always a really nice thing. And if we could do more outreach, I think that would be great. But even the once a week is really good, and I think it is really important.
Good. I'm getting to know people. I was very pleased to have been given a few big mud crab last week, which we had a feast on. That was great. I'm starting to get to know people, visiting some people at home. I've had some pretty close and some sorry business with some families that I've been involved in as well. So I'm getting to know people. It takes a while. I wouldn't say I'm close yet, but I'm getting there.
I think it's maintaining connection with country and with people, coming out to their country and to be able to provide a GP service for them is the most important thing for our mob.